So we were just asking, what led you to think that the first time you did the bypass, that it was going to work?
Well, because when I was training with Dr. Wangenstein, and we made we had the clinics, and the first resident that he had in the laboratory had developed an ulcer.
Oh.
And he did his operation, and he lost weight. And he could never get his weight back. And when we'd go and see these patients, they'd complain about their weight loss, and he'd say, well, you're better off for it, you live longer.
He was right, wasn't he?
and you'll be healthier.
He was right.
Oh, yeah.
It's so true that in medicine you have to observe, right? You learn a lot from your patients.
Yeah.
You sure do. Some of those patients with the ulcer operations have diabetes when they got operated on?
Oh, yeah. In 1977, we talked about, we had data at that time about the cure of diabetes. The only thing we didn't have in 1977 was knowledge of how it worked.
Were you surprised when you saw the diabetes get better afterwards?
Everybody was.
I think we all were. We were always struck by
Every surgeon that ever did an operation for obesity has, I mean, you can't avoid being surprised.
It's a miracle. It took observation, to figure that out.
It took observation, but it was an observation you could hardly avoid.
You came up with the name, the American Society for Bariatric Surgery.
The ASBS.
Yes, the ASBS.
I mean, we had the American Society for Surgery, and so we had an American Society for Bariatric Surgery.
People were not that obese, that heavy at that time in America, or were they also already that heavy?
No.
No.
I remember when I was a medical student in 1943, we had a patient that was on 2 beds. And it was a sideshow.
Yeah. It was unusual.
Everybody came around to see the patient on 2 beds. The epidemic really got going about 1980.
Why do you think it increased so much? You're the father of obesity surgery. Why do you think obesity's increased so much in this country?
Fast foods.
Fast cars, lifestyle,
Fast everything.
Yeah.
Except for walking.
That's right.
Yeah. No exercise.
I walked back and forth to school at noon.
Yeah.
All through grade school and high school.
Yeah. I bet lunch was made at home, right?
Yeah.
Yeah.
I had to kind of rush to get back to school in time, but my BMI is 20, about what it was then.
What made you decide to go into medicine?
When Dad moved us to Iowa City, I went to the university school where the students were either from farms or professors. And my friends were university hospital teachers. I thought that looked pretty good. And, well, the surgery I latched on to when I read a book by a surgeon who was at Johns Hopkins, and he didn't think the chief of surgery was paying much attention to him. So, but he one day he came around the corner and slammed into this to the chief of chief of surgery, and the chief helped him get up, and the chief said, "I was just looking for you. I wanted you to be chairman of urology."
Wow.
And he developed an operation for removal of cancer of the prostate.